Good morning and great welcome to our guests and attendees, teachers and doctors. Today we will discuss a topic of a new study done in Iraq for the first time regarding the macular thickness in strabismic amblyoptic children using ocular OCT. As we know, amblyopia for many years is regarded as a disorder of the visual system in which an organic cause cannot be identified, but OCT opened a new horizon in understanding the pathologies of amblyopia. The prevalence of amblyopia in many countries is between 1 to 4%. And this is a result of three mechanisms, either sensory, refractive, or strabismic. The mechanism of development of amblyopia involve affecting various levels of the visual system. In recent studies, there is a reported atrophy of cells in the lateral geniculate body, mainly the parvocellular layers, and also there is a shift in the dominance pattern in the visual cortex, which could be one of these effects. But, however, whether the earliest part of the visual pathway is involved is remain a mystery. For that purpose, many countries is still doing many studies to reach to the truth, whether it is involved or not. And our country is part of this mission to do these studies to add value. So our study in numbers, it is the first study done in Iraq and the third done at the level of Middle East after Egypt and Lebanon. Important topic is to discuss the link between amblyopia and visual pathway, retinal brain. This diagram summarizes this link starting from the earliest part of the visual pathway from the optic nerve and retina regarding macular thickness, which is still the mechanism is unclear. Optic nerve and optic tract, there is reported decreased fractional anisotropy in them, and lateral geniculate body, there is a decrement in the gray matter and reduced blood oxygen level dependence, and regarding the primary visual cortex, there is a decrease in the visual evoked potential. Aim of our study is the use OCT to measure the macular thickness in children with strabismic amblyopia and compare the results with control fellow eyes. Our study is a cross-sectional study, involves 30 children with 60 eyes grouped into two groups. Group 1 labeled as a group of amblyopic eye and group 2 labeled as a control group. The study held at Al-Nuaimi Tertiary Eye Teaching Hospital for the period extended from August 2021 to March 2022. Inclusion criteria: any child presented with the newly diagnosed strabismic amblyopia, age between 5 to 16 years, both genders. Visual acuity of the fellow eye best corrected between 6.6 and to 6.9. Axial length between 22 to 24. Exclusion criteria: any refractive error apart from 1.5 diopter sphere or 1 diopter cylinder. Any neurological abnormalities, any sensory causes of amblyopia like ptosis, corneal opacity, cataract, or any visual opacity. Axial length below 20 and more than 24. After we received the patient, did a proper ophthalmic examination, visual acuity, and full assessment of the ocular deviation, followed by cycloplegic refraction, fundus exam, and tear segment exam, then measurement of axial length using B-scan, and measurement of macular thickness using OCT. We measure the fovea and parafoveal areas, which are divided into 4 quadrants: superior, inferior, temporal, and lateral. Regarding the results, distribution of macular thickness, the importance in this result, there was no statistically significant difference in the overall areas was studied, central, superior, nasal, temporal, and inferior, as revealed by the p-value. Any p-value below 0.05 is regarded statistically insignificant. So here the p-values all are above 0.05. This table also illustrates the result from other point of view, compare if there is a link between the severity of amblyopia and the macular thickness. Also, there was no statistically significant difference between two groups, mild versus moderate to severe. Discussion, our findings are consistent with many of the studies, but other studies also report there is a significant difference, especially in the anisometropic causes of amblyopia. Our conclusion, there was statistically no significant difference in the macular areas, fovea and oporophovia, and our recommendation for future work is to increase the sample size, is to assess the macular thickness layer by layer, not a whole as we did here. Unfortunately, we couldn't measure layer by layer because of the unavailable facilities of devices, and also to include the other causes of amblyopia. These are samples of our cases, and thank you for active listening.